Hi, I'm Abby Joyle,
And I'm Katie.
and we are doing the position statement on management of sports-related concussions.
So, just to give you a little background on what concussions are, they occur from forces applied directly or indirectly to the skull that result in the rapid acceleration and deceleration of the brain. Concussions are the most common in contact and collision activities, and an estimated 3.8 million concussions occur each year in the U.S. as a result of sport and physical activity. Athletic trainers are commonly the first medical providers on site to identify and evaluate these injuries, so that's why we're making this video.
For education and prevention, the AT should work with the appropriate administrators to ensure that parents and coaches are educated on the following aspects of a concussion: prevention, mechanism, recognition and referral, appropriate return to participation, physical and cognitive restrictions for concussed athletes, and ramifications of improper concussion management.
So part of the athletic trainer's job is defining and recognizing concussions. So the ATC should develop a high sensitivity for mechanisms and presentations of traumatic brain injury, including mild or severe cerebral concussion and other brain injuries. The state of an athlete who has sustained a concussion is initial confusion, which may disappear within minutes, leaving no observable signs and symptoms. The ATC should play an active role in educating athletes, coaches, and parents about the signs and symptoms associated with concussions, as well as the potential risks of playing while still symptomatic.
The athletic trainer should document all information regarding a concussive injury, mechanism of injury, initial signs and symptoms, which should include nausea, dizziness, vomiting, headache, balance problems, feeling slowed down, fatigue, trouble sleeping, drowsiness, sensitivity to light and noise, loss of consciousness, blurred vision, difficulty remembering, and difficulty concentrating. You also want to assess their state of consciousness, findings on a serial testing of symptoms and neurophysiological function, and postural stability tests. Instructions to give the athlete and or parent, recommendations provided by the physician, date and time of the athlete's return to participation, and relevant information on the player's history of prior concussion and associated recovery pattern.
So part of evaluating and making the return decision play is a protocol that should be set in place between the athletic trainer and the team physician for managing sport-related concussions before the start of the athletic season. The athletes who participate in high contact or collision sports require a baseline test that is required every 2 years for the athlete at the beginning of the sports season. The ATC should record the time of initial injury and document signs and symptoms. They should also monitor the athlete's vital signs and level of consciousness every 5 minutes after concussion until the athlete's condition improves. Athletes should be monitored over the next few days after the injury for the presence of delayed signs and symptoms and to reassess the recovery. Once symptom-free, the athlete should be reassessed to establish that the cognition and postural stability have returned to normal for that player. The return-to-play protocol decision should be made after an incremental increase in activity with an initial cardiovascular challenge followed by sport-specific activities that do not place an athlete at the risk for concussion. The athlete can be released to full participation as long as no recurrent signs or symptoms are present.
There are many concussion assessment tools, such as baseline testing that you want to do with your athletes. You want to do this baseline testing before the sport season begins. A good baseline test is the impact test, which is taken online and assess an initial neurological component. You also want to do an objective concussion assessment, which can protect players from return to play being too early. So this includes a cognitive test, stability tests, and self-reporting symptoms. You can also do sideline testing once you have a suspected concussion. This can include the BEST test, an SAC test, or doing a symptom checklist, which is a SCAT-5. It's important for the athletic trainer to know and understand instructions and scoring, and the return to play protocol should not be based on just the use of one test. If your athlete is having symptoms for an extended period of time, they should be referred to see a physician, especially if they have loss of consciousness or are experiencing amnesia that lasts longer than 15 minutes. You should also refer them to a neurologist if their signs and symptoms get worse or if they are having trouble sleeping. They cannot return to play if they are symptomatic and rest and after exertion for at least 20 minutes. Some exertional tools you can use to test this is running, sprinting, push-ups, sport-specific activities, non-contact activities, and jogging.
So, just some facts about the young athletes and concussions. With younger athletes, recovery time may take longer, so that's why it's really important to educate athletes and parents and coaches about what to look for the dangers of repeated concussions, and just to be aware about second impact syndrome is a higher risk in young athletes. And just some home care to take. You want to avoid alcohol and drug use if you have a concussion. You want to rest as much as possible. You want to avoid activities that increase symptoms like using a computer, watching TV, using your phone. It's also helpful if you eat a well-balanced diet and wake-up checks if they experience loss of consciousness and check for any deteriorating symptoms.
We hope this has been educational for you, and that's our position statement. Thank you.